worth it.
Something a little different today, the removal of a birthmark right here at Dr. Steve Mulholland's.
What you're going to see today is the treatment of a birthmark. The beauty of the laser technology is that it bypasses the skin and goes right to the blood vessels, so that you get a very specific treatment and a fading of the actual blemish without affecting the overlying skin, rarely with any pigmentation change, and no scarring, which is what people are looking for.
So, Gail, how long have you had this birthmark for?
As long as I can remember, always as a child.
I see. And why have it removed now?
Well, I tried about 20 years ago, and the doctor, when he looked at it, felt that there could be muscle damage left after they removed it, or I may end up with a circle still there. And he suggested it wasn't really, because there was no muscle tone damage now, he suggested not to do it. So now the technology's here that can completely wipe it out, and I'm going to give it a try.
What we're going to do now is fire the laser in pulses at the blemish. As you can see, after every pulse of the laser, the blemish turns black and blue, almost like a bruise. And so what I tell patients with birthmarks is they don't have to do any skin preparation, they don't need any anesthesia, no freezing, they can just lie down and have it treated. The laser itself explodes under the skin the tiny little vessels that make up the blemish, and that's what the bruise is. As the bruise fades over the next 8 to 10 days, what Gail will find is that her blemish has lightened significantly. She may need 1 or 2 treatments spaced out by about 6 weeks until complete clearance is achieved, but I would say most patients with birthmarks get between 90 and 100% clearance of their birthmark after 2 to 3 treatments.
So, Dr. Mulholland, the procedure now is finished?
Yeah, Gail has completed her treatment. You can see the bruising from the laser, but in the words of Gail, I don't think it's very uncomfortable. In fact, most patients don't feel anything once it's completed.
I don't.
You don't feel a thing?
Nothing.
Oh, very nice.
It actually looks worse than it is. And then I put a little bit of polysporin, an antibiotic ointment, on just for the ride home, and then Gail can start using any soap and moisturizer she wants, and just sun avoidance with some sunblock, and that's all she has to do.
Wow, it's pretty amazing stuff.
It is, because a lot of these birthmarks have been there since they've been 1 or 2 months old.
Sure.
And as we mentioned in the break, called the kiss of God, and it's really a hereditary thing. You can't do anything about it, they just develop.
Yeah. What did your mother say? That was a
stork bite.
It was a stork bite. My mother said God kissed my sister. That was kind of a nice thing to do. But you know what? I got to tell you, with the technology the way it is today, the treatment can be done. The question is, how many treatments does it take?
Yeah, this was a very tiny birthmark. Some of them, you've probably seen.
We're going to take a couple look at befores and afters in one moment.
Some occupy half the face.
Yes.
There can be complex involvement underlying brain and neural tissues. So you have to really see a doctor, and your physician would refer you on after assessment for laser treatment. The laser treatment really deals with what we can see on the skin, and it takes about 6 treatments over about 12 to 18 months to get one of the larger ones to fade. But they're very well tolerated. You can see that lady had no topical freezing, no pain medication necessary.
And I'm guessing it's very individual how you can recover from this. I mean, some people just recover, faster than others. Is that?
No, absolutely. It does vary, but it doesn't hurt. It just looks very bruised, and so people present a very shocking appearance.
Yes.
So I always tell people, you're going to look unpresentable for about a week. Just hang out and watch some movies, read, go to the store with a shawl over your face. But after about a week to 10 days, it fades very quickly.
Let's take a look at, you brought in 2 pictures of befores and afters.
Examples of a very young child, and sometimes...
Can I have it in the main monitor, please? Thanks.
As you can see, most of these occupy areas of the face. And even as see, that young fellow is agreeing with me.
Yeah, there you go.
Even as early as 10 years ago, we didn't have a lot of options to treat these, and so people would generally leave them because no one wants to exchange a birthmark for a scar that's more disfiguring. With the specific lasers we have now, you can see after 6 treatments, you have a fairly happy little fellow there. And again, this is very, very early treatment, and around the eye, you might want to do that because these get larger and can actually compromise the vision.
So I was going to ask you about the age. I know now, like for a lot of us, the technology is great now, so of course we're going ahead to doing this. But this you saying has to be done early because it could really take on more of...
Yes. As you get older, it can either, in the instance of an eye, it can compromise the eyelid and closure, but as you get older, they tend to get very, very dark purple, raised. You may have seen people in the street like that with little lumpy, bumpy parts to it.
Yes,
and that gets very difficult to treat at that age. So you want to definitely see your physician. If you have a child who's suffering from this, often parents will now treat before they get into the self-awareness ages, 5 or 6, where they can get teased by their classmates.
Right.
And almost every major city in Canada will now have the type of expensive lasers that are used to treat these, and that will be covered by most insurance plans.
Okay, that's good to know. We have another set of pictures here that I'd like to take a look at.
In the adult phase, a lot of adults have been told at one point or another growing up that you can't treat this without significant scarring, and so they've left it. And they're really quite happy when they can find out now that you can get a treatment that will improve this. This would be over 6 treatments, about a year to 1.5 years, and as you can see, in most instances you can get almost complete resolution of the birthmark. So although it is sort of aesthetic in nature, it really it impacts people's quality of life because they now feel different about themselves. They project themselves differently. They end up walking with their face forward rather than walking like a crab sideways.
What about there's no return of can they return?
There can be. What we're doing
depends on what it is, though.
Yeah,
like I'm looking at this the little boy that we saw, okay, and he had a little patch. Now, does the GP, you're constantly watching for that to reoccur? Is that?
You should watch through the family physician that there isn't little islands that regrow or get larger, and then they can easily be retreated and touch up.
Parents watch. Parents watch,
Parents watch, and the parents are so aware. And when you have that type of dramatic change, it's so amazing, so terrific. Not only in that age group, not so much for the child's self-esteem because they're not even aware of that, but the parents' attitude and the way they respond to their child, and therefore the way their child will respond to them and to other people. Whether you're aware of it or not, often when we see our child as having some type of either disability or handicap, or what we perceive as a disability or handicap, the way we treat them is different.
I don't know much about birthmarks. I don't know why they happen. I don't know if they can be prevented. And I don't know, is it always on a certain part of the body birthmarks happen?
They tend to, it's almost all genetic. It's all in the genes. You can't always say that you're going to pass on those genes. There's no way of tagging it. There may be a family history and there's certain syndromes, but most of these aren't syndromes. A lot of them are just spontaneous events that occur, bad luck, draw the genetic card, and there's no reason to feel guilty. No one's to blame. It's just random genetic event. And fortunately, most of them can be treated, and they tend to be located on the extremities or on the face, and in a certain distribution.
Okay, very good. Well, thank you. You're going to stay with us?
Absolutely.
Okay, I learned a lot about birthmarks today. I appreciate that. We're going to take a break. We'll be right back.